This is Sabrina Escobedo. I'm on the line.
Oh, great. Yeah, welcome, Sabrina. Okay. I think that's
Annalise
enough
Shahan, I'm here. I finally figured out my audio.
Oh, thank you. Okay, welcome. I think there are enough committee members on now.
Michelle Newman on here.
Welcome. That we can go ahead and get started. And other committee members may join us. So you are joining the monthly meeting of the Child Care and Education Committee of the Early Learning Council. And this is, and we're, today we are assuming the role of a rule advisory committee for the child care rules. That is a role we've been playing for a couple of years, and we've moved into other work, and because the council has adopted a strategy of creating rule advisory committees for every set of rules. So we no longer, this committee will no longer be the rule advisory committee for all rule sets, but because we've already done so much work on the child care rules, it made sense for this committee to pick up the process now as we're nearing completion. And so we will resume our other work in June, but today we are focused on the child care rules and acting as the rule advisory committee. So I'd like to take a minute and have members of the committee introduce themselves. Just to make it easier, I think I'll say your name. Elvis?
Yeah, Elvis Argueta. Yeah, Elvis Argueta, SEIU Local 503. I work with regulated subsidy providers.
Great, thank you. Sue Norton?
Sue Norton, I work for Lane Community College. It's SBA 6 for the Child Care Resource.
Okay. Donna?
Donna Schnitker, council member and also early learning director for Harney ESD and the Oregon Head Start Association president.
Welcome. Sabrina?
Sabrina Escobedo, Education, Mental Health, and Disability Supervisor for Oregon Child Development Coalition out in Mount Airy County.
Great, and I'd love to see your cameras, Donna and Sabrina. That's such a help. Abby?
Hi, sorry, Abby Bush with the Oregon Community Foundation.
Welcome, Abby. That we caught you on mute at first. Leslie?
Hi, Leslie Barnes with the Child Care Resource and Referral in Multnomah County. I work with Family Child Care Networks.
Right. I believe that's all the members of the committee. Did I miss any committee member? Okay, I should introduce myself. I'm Bobby Weber, and I am a member of the council and I chair the Child Care and Education Committee. If you are not speaking, would you mute yourself so that we don't get the background noise? Dawn, can you introduce yourself and the staff that's on the call?
Certainly. Good afternoon, everybody. This is Dawn Woods, and I'm the Child Care Director for the Early Learning Division. And in the room here, I will have them start introducing themselves.
This is Alyssa Chatterjee, and I am with the Early Learning Council.
This is Chris Plattner. I'm with the Early Learning Division.
And Tammy?
This is Tammy Scott. I'm one of the regional managers with the Early Learning Division.
Catherine? Hi, this is Catherine Miller, and I'm one of the regional managers for the Early Learning Division. And is Lisa on, Pinero?
I don't see her name. She could be here with one of the numbers. Lisa?
Yeah, I wasn't sure if she had joined yet or not, so. Okay, so I think, did I miss anybody from the division? Okay, I think that's it, Bobby.
Thank you. Okay, so now members of the public, if you would like to, you certainly don't have to, but you are welcome to introduce yourselves. A lot of you, I just see phone numbers, so I can't call you by name to make this an easier process. But if you'd like to tell us that you're participating in this call, I'll just be quiet and give you a chance to do so.
You could also call by the last 4 digits of the phone number.
Okay, I'll do that.
Not sure if you can see us, but
597. Oh,
let's see. I think the camera's on. Let's see. No, that's sound. That's sound. Oh, maybe we'll figure out how to run a camera here. No. Anyway, here's the Cromers. Hi.
welcome. Okay. 8597, last 4 digits of the phone number. Okay. 0896.
That's me, Bobby. I'm going to log out and log back in to match it.
Okay, great. 7097. Oh, Gayla says that she's here. Welcome. 1471, last 4 digits. 3273.
This is Autumn David. I'm a child care provider.
Okay, thank you. 601. Please do
I put the paper in there when I'm tapping you. All right, everybody, if you could help us out and mute your line if you're not talking, we're getting a lot of background noise. Also, if you haven't participated on one of these calls before, if you're on the phone, you also need to mute your computer, and that could be some of the echoing.
Thanks, Dawn. Okay, 5506.
Hi, this is Anna Marie Holloway, Miss Ann's Kitty Corner from Riddle, Oregon.
Welcome. 1138. $6727.
Hello, my name is Gabriella Bailey. I am a child care provider.
Welcome. 0905.
Shanna Aldis, child care provider.
Welcome. Sherry on an iPhone.
Yes, I'm here.
Okay. Welcome. Catherine Slagle. Hope I. Well, please check again about muting. Um, 8597. Okay. And Angie. Elise.
Please lay down.
I see in chat that
meeting.
Okay. That Jacqueline is here, so thank you, welcome. Comers have introduced themselves. Eva? It's really hard. Okay. I think we'll just try to get started because this is, I think, causing more difficulty. We just wanted you to know we're all glad that you're here. And now talk a little bit about.
Hey, it's really hard to hear you behind that typing, Bobby. I'm sorry. Someone's typing in the background and it's hard to hear.
Yep. Okay. Fine. Am I muted? I'm unmuted. Okay. You type in chat if you want to speak, and Chris will unmute you. But it just was, we couldn't hear. So I'll go through the rest of the the review of the agenda. And thank you for those people who are letting us know you're here. Welcome. So today is part of a larger process that started, and Don will give us some background, but it started, maybe at least 2 years ago, where the council adopted a set of principles for reviewing rules or writing new rules, and we applied them to the child care rules, and that led to doing a revision of the rules and a massive process of gathering input from providers and others. This committee itself has done quite a bit of giving the input, but so has a broader community, and Don will go through that. Then the Child Care and Education Committee is not a body that acts. It's the Early Learning Council that adopts rules. So our role is to facilitate the process by discussing issues in more depth, and then in areas where we reach agreement, we let the council know, and in areas where there are still issues that the council should address, we move those forward. And when the council takes on the role of rule adoption, it will, these areas will be identified and there'll be discussion. Other kinds of public processes that are going on right now, public comment is being accepted, actually being sought, welcomed, and then on next Tuesday, there'll be the public hearing on these rules. And it's important, and I think we'll say this more than once, that a written comment that's submitted at any time carries the same weight as a statement made at the public meeting. In either case, the opinion is highly sought and will be seriously considered in the process. So, and then in May, the Early Learning Council will actually have, will act on the rules, and that process will involve all of the input that's come from a variety of sources. So the items you see on the agenda today are ones that have risen to the top in the engagement process to date as issues that needed more discussion. The committee has already discussed these topics, but but then we've gotten public input, so we're going to discuss them again and see if we are at consensus on our moving forward, or if we're going to send it to the council as something to be deliberated at the council level. The only change in this is that we are going to remove the section of the agenda dealing with the school age definition, because staff are still gathering information, so we don't have enough information for the committee to deliberate on the definition of school age, and so that's one that will go to the council. And I'm sure in the public comment period, we'll continue to hear about that, but the staff also needs to do more research. So the topic, we had hoped that the research would be done and we could do the actual discussion of it today and facilitate the work of the council by sending our thoughts forward, but we're not at that stage. So we'll cover the other ones. So the
so Bobby, we're
yes.
skipping this. We're skipping the school age definition because it's not done yet by the staff, and then it's moved, and then it's going directly to the Early Learning Council. Is that correct?
That's correct.
Thank you.
Yes. Thank you. Yep. We thought we were going to have all the information we needed, but we don't have it yet. So the staff is still collecting information.
I appreciate it.
Yeah. So the first thing on our agenda, if you remember, all of the Early Learning Council's committees are engaged in the strategic planning that the governor has asked the council to lead for all state efforts. And so at every meeting, Alyssa gives us an update. Alyssa, are you ready?
Is she on mute?
I don't know. We can do it later if this isn't a good time for Alyssa. Dawn, can you weigh in? Should we wait and have Alyssa do it later in the meeting?
Yes, Bobby, I apologize. Hello, can you hear us?
Yeah, I can hear you. This is Elizabeth.
In our efforts of getting it kind of quiet, we accidentally muted ourselves. So we are now with you. Sorry.
So Alyssa, is this a good time to do the update?
Yes. Yeah, can you still hear me?
Yes, we can.
Okay. I'll just be really quick.
We're hearing background noise. Could it be coming from your phone?
We're not doing anything in here.
It sounds like R2D2 is behind you or something.
Okay. I can give an update later. I'm sitting in the same room as Dawn, but I don't want to take too much of this committee's time. I think June will be the more comprehensive update. So we'll try to work on tech on our side, but I think we can move on.
Okay. So the process we're going to use, staff prepared. This is going to be really your phone.
You need to go to bed. You're tired, Bubba.
All right.
Can you tell if it's Dawn's line actually?
Hi. Can you hear me now?
We can, but we also are getting all kinds of background noise.
Right. We're trying to go through and mute people. We have people not muted on the line. I'm really apologizing. We are working on the technology right now, everybody. I think having this many people on this is making it somewhat challenging.
Okay.
And I do apologize.
So the noise will go away as soon as staff are able to mute the other line. Does that?
That
was it.
There, listen, so much better. Okay,
yes.
so.
Can you hear me, Bobby?
Yes, I can.
Great.
So that's great. So the process we're going to use is we're going to take public testimony from anyone who wants to discuss safe sleep and swaddling. And we hope to do that in about 15 minutes. So if you could kind of gauge your testimony so that everybody gets a chance to speak. And then the committee is going to go into a discussion that and Don will lead us through the areas for discussion. Don, did you want to do some opening comments though before we took public comment?
Yeah, Bobby, if that's okay, I'd like to.
Great.
Okay. So while we're getting the PowerPoint up,
for some reason, I'm seeing Chris's face instead of your face, which is okay, but I just wanted to let you know that's what my computer is showing.
I appreciate it. She is the other half of my brain, and she tries to keep me organized, but we will get it sorted out. Alyssa and her are working on the technology. So in the interest of time, while they're figuring that out, I can kind of expand on what you said, Bobby, around the work that we've been doing with this committee. So actually, we pulled out the chronology of the work that we've done, and we actually started meeting with this committee back in August of 16. And so we have been working through these different policy topics that we've, worked with this committee on since that period of time. And so we've had many meetings and kind of robust policy discussions around these topics as we've been going through this rule revision process. And I think it's also important to note that really the goal of this rule revision was to align, which really falls in line with the guiding principles that the Early Learning Council adopted, to clarify and to strengthen. I think it's also important to note that rule work is never done. It's somewhat of an art in writing, and we really see rule writing as an iterative process that we will be continuing to go through. I definitely don't want anyone to feel like we think we have it all right, and that we will continue to engage so that we can make any changes needed to really strengthen, clarify, and further align to ensure the health and safety of young children. Other engagements that we did to be beyond that actually really connected to this committee's work is we did several surveys, both to parents and providers, about different topics that we were able to bring back to the committee to help in their deliberation around the policy topics, as well as worked with other agency partners such as the USDA food program, health partners, environmental health specialists, to really kind of get their take and best practices as we were doing the rule revision. Again, on top of the many surveys that we did out to the provider community. And again, as I said, with rules being an iterative process, we'd also compiled a lot of comments over the course that we looked through. We called it put it in the hopper. So everything that we've been gathering over the years all came into play as we worked on this rule revision. I think it's also important to note that some topics would go also to the Equity Implementation Committee as we were working through them to get a lens on them, and did regular reports to the Early Learning Council on our progress and the topics that were covered in Childhood Care and Education Committee. To date, we've received about 80 public comments across all the different types of care. Do we have the PowerPoint up? And so Chris is going to pull up the PowerPoint that kind of gives some of the timelines of where we are now. Let's see. So currently, we're here with you today to go over the feedback that we've received on the themes. ELD staff have been throughout this process reviewing all the feedback as it's received and summarizing those themes, doing the additional research, and then really drafting the changes to some of the areas based on the input and the research. So our timeline, scroll to number 2, third slide. The timeline is we're looking at the equity implementation, next one, committee will review the potential equity concerns on May 15th. We'll be taking some of our conversations from today to that committee. We have a public hearing held on May 15th. Can you guys forward? Okay. And public hearing is going to be held on May 15th here in Salem at 6 o'clock. But again, I want to emphasize what Bobby said is that the written and verbal public comment is all, you know, we look at it all the same. It's all weighted equally. And I will say that depending on the public comment, you actually have an opportunity to further expand when you provide written testimony. You may have more time to say, to be able to give your input. But the public comment period does close on May 21st. And then as Bobby referenced, we'll be going to the Early Learning Council and presenting the rules and the work that's been done and look to have them promulgated at their May meeting. I think it's also important to note that, you know, the promulgation of the rules is really the first step in terms of the training and technical assistance that then we'll be offering for staff, providers, and parents and partners with these new rules that will be in effect September 30th of 2018. I can share that currently staff are working on a lot of technical assistance documents. Our rules will have some additional information about what that might look like to all help everyone really understand the new rules and what that might look like in the different environments. So the policy topics that we are going to be addressed is really, you see on the agenda and also on here, minus the school age definition. So Bobby, if you have any clarifying points that I may have missed, I think we're ready to move on to the next part of our agenda.
Okay, so at this point, we are planning to discuss each of these themes separately, take public comment from anyone who wants to share ideas with us, and then the committee will have the discussion. So I'd like to open the, how do we do with phone lines, Dawn? For people who want to speak, how do they let Chris know to unmute them?
I think what we, they could type in the chat box, but yeah, if they're just on the phone line, I think they can hit *6 and unmute themselves.
So what's gone up is the draft rule language and a summary of the public comment. And now we're open to other public comment.
We are hearing some rather soothing background music playing, so if you are around some music, if you could mute your phone. Unless you'd like to testify or offer some public comment.
I'm not sure whether it's that nobody wants to comment or if they're having trouble with the phones.
Maybe we should try to unmute everyone. I'm a little risky about that, but I also want to be sure. Oh, great. We have someone who raised their hand.
Perfect.
Romer, would you like to start?
Sounds good. Can you hear me? Or do I need to unmute?
Yep.
Okay.
No, you're good.
Yeah, so I would just like to testify about the swaddling infants. Of course, way back in the day when we first started, we swaddled all of our babies who were fussy, and then as time has gone on, there has been less swaddling. However, we still have what I would consider colicky infants whose parents request sleep sacks, and I'm not sure how those children would sleep without those. We have tried since this whole discussion has come up, and we've had some very unhappy parents. So I would just like to request that that not be a consideration, because I think we'll probably have to end infant care if we are not able to help families with keeping their infants warm or feeling comfortable like they do at home. That's it.
A point of clarification on this. My understanding is that the recommendation on loose fitting sleep sacks is that it should be continued. It's the swaddling that should only be done by parents. Is that, am I understanding the advice that we've gotten?
Yes, hi Bobby, this is Dawn. And yeah, we've received significant public input on that, and that was never the intention of the rule. So that's some work that we're doing to clarify that sleep sacks are definitely fine to use as long as they're not mobile. There's some considerations around those. And so that clarification will be seen in rule revision as well as in technical assistance documents, because that was never the intention, was to not allow sleep sacks.
Okay, very good.
Can I ask a favor? Can we just listen to all the public testimony? I'm not sure. I just want to listen through all of it before we go in and out.
Thanks. That's a good idea, Elvis. Thank you.
Hi, this is Renee. I'm a child care provider of 18 years and have had many child care kids come. Yeah, child care provider. And we have had many kids come through the door and have, what do they call it, twitching, where the infants twitch themselves awake. They can only sleep about 20 to 30 minutes at a time unless they are swaddled. And my 2 cents worth would be to continue with a type of swaddling. I've actually never used a sack, never even heard of one until recently. Unfortunately, it was bad news, but that might be something I'd be interested in looking into. But there are swaddle devices that have been used, and they've worked well in the past, and would like to continue using that.
Thank you.
Mm-hmm.
Hey, Bobby. Anna Pickle has a comment.
Okay. Thank you. Do you want to read it, or does Anna want to speak?
Oh, no, I'll speak. I'm sorry. I was just waiting my turn. So, yeah, Anna Pickle. I'm a certified family child care provider. Only swaddles that I have ever used are the Swaddle Me Velcro blankets. I use them for my own children as well. So they are, they're very similar to a sleep sack. Except for they're, just a little bit more tight fitting, and you're able to like Velcro the arms down so that the babies can't get their arms out as easily, like if they're just using a regular blanket. So they aren't posing the hazards that a blanket would pose, where if a baby does get their arms out, they're not going to have a blanket, over their face or things like that. And they come in different sizes. So for me personally, that is the type of swaddle that I would like to see being allowed with the rules, because, I don't feel that there's any type of risk with using those. I've been using them for years. I've used them with every infant I have ever taken care of. And especially for a lot of us, when we have babies start with us at 6 or 7 weeks old, those babies will not sleep unless they are swaddled. It's, they just won't, because they startle themselves awake, which is developmentally appropriate for them. So we try to, familiarize them with what they're used to at home, which is typically being swaddled by the parents. So I was also very happy to hear that sleep sacks, we were not trying to disallow those either. But I would just like to see some type of compromise made, because when you have 4 infants that you're trying to take care of, along with 10 to 12 preschoolers, depending on your license size, it's very challenging for us to have cranky, tired babies that don't want to sleep, and still be able to, do our jobs and keep everyone else's needs met. So.
What was the name of that blanket? Sorry, I just now joined and I heard half of that.
It's called a Swaddle Me. They sell them. They sell them at Target. You can get them anywhere. They come in small for when you have like a newborn baby, and then they come in a bigger size for when they're older. Like I have a 5-month-old infant right now. He will not sleep unless he is swaddled. That's just the way both my children were. Like if they were not swaddled, they would not stay asleep longer than 5 or 10 minutes, because they would wake themselves up with their, hands grabbing at their faces, or things like that.
Yeah, I'm having that problem now. I have a 6-month-old. By the way, I'm Brenda. I just joined.
Hey,
I'm a child care provider.
Hey folks, can we keep it to the public comment? I just want to make sure we keep it to the public comment, so everybody gets a chance. We have time. Is that cool, Bobby?
Yes, absolutely. That was all that I had to say. I just wanted I guess it says in here that we should have some type of swaddle that would be approved, other than a blanket. That's what I would like to see, the Swaddle Me blankets. Or there's also the Halo sleep sacks, which I believe are very similar, and they have some type of Velcro that wraps around the top part, and then the legs are loose so that babies can kick their legs around if they want to, and it just helps restrict the arm movement so they aren't, startling themselves awake or, scratching themselves in the face when they're sleeping, things like that.
Thank you. Was there I heard 2 voices at the same time. Was there someone named Bridget who wanted to make a comment?
Hi, Bobby. This is Chris. I do have a comment from the chat from Jacqueline, saying sometimes we have parents request for swaddling their babies in order to keep kids sleeping more than 15 to 20 minutes. We do not use devices at all. We hug babies until they fall asleep. And then Gabriella is next. Go ahead, Gabriella.
Hello, can you hear me?
Yeah.
Yes.
Hello? Yes, okay. So I have my child care, but we serve children over the age of 18 months. And so actually I'm making this comment as a parent. I am a Reggio affiliated school, and I believe very much in relationships and family and community. And I personally don't know what I would be able to do if a parent came to me and said, this is our practice at home, and I wasn't able to mirror it or at least match what they were requesting. And so I have a big concern for providers who care for infants not meeting the family's requests or needs. And then what about the family connection? Like, we got to think of something that we can be trained better in practicing safety for the child to swaddle and to have this type of care that parents are requesting. And so I think it's important to represent the families. And so I'm representing the families who are upset over this and are asking why and want to know, because that is how their baby sleeps at home, and babies need sleep. And it's important. Otherwise, they get a cranky baby. And so I think it's very important to be able to meet the needs of families and practice safety as well.
Thank you.
Bobby, Annalise has a comment.
Okay.
Hey everyone, I just want to say that I had proposed some rule language to Dawn a couple of weeks ago, I believe it addresses the concerns around blanket use and the age and the stage of the child and safety, as well as the hip dysplasia issue. I just want to remind everyone that Danette Glassy, who was the MD that represents the AAPs, she's the chair of the Early Education and Child Care branch of the AAP recommendations group. She has indicated that the reason that the AAP does not recommend swaddling in child care settings is because the AAP recommends infants wait to enter a child care center until they are about 3 months old, and then by then swaddling should be on its way out. So I hope that everyone will take a look at our language and that we can come to some sort of compromise where families that want their child swaddled and child care programs that want to swaddle can do so safely, and that we can represent all cultures, all views, and keep children safe.
Thank you. Chris, has anybody else indicated an interest in speaking?
Bobby, it's just, I think Chris said just Sue Norton as a committee member. So I'm not sure if we're...
So we're going to have a discussion after the public comment period as a committee. Any other public comment? Okay, so Dawn, was there more information that you wanted to share with us before the committee starts discussing this issue?
Well, I think maybe just some context of what the rule is that we had proposed, and just maybe just make a few comments about caring for our children for the committee. Is that?
We have one more comment.
Okay.
Let me, Gayla, I'm sorry, I do apologize. I see your hand. Let me unmute you. Okay, go ahead, Gayla.
She's not unmuted.
Gayla, are you muted?
Hang on. Gayla, you're going to have to unmute yourself. I'm not able to unmute you from my controls.
Or you can comment in the chat box and we can read your comment.
Issues.
Okay. Yeah, so Gayla, if you would want to type those in the chat box, then we would be able to read them to everybody.
She said okay, so I think go ahead, Dawn.
Okay, so we did clarify that the intent was that loose fitting sleep sacks would be allowed, and that in the public comment, I think essentially the public comment hit a lot on the testimony that we've received thus far hits a lot of what we have heard today, and that what it is, and from caring from our children, is that they recommend in child care facilities not to swaddle, but it is correct. They also recommend that children not go into child care until 3 months of age, but also recognize that that's not always an option that families or states may have. And so I think that would be the only context in terms of where we looked at for our information was from caring for our children for early care and education programs.
Okay.
I did get myself.
Oh, great.
I am a credentialed early childhood development master teacher. I've been a licensed provider for 15 years and provided care in California, Idaho, and Oregon. I was in Oregon for, I think, the last 12 years. I've cared for so many infants, children for over 40 years, and I have never not swaddled a baby. It's taught to us in the hospitals with our newborn infants how to do it correctly, or at least it was when my babies were born. I think a lot of the comment that I wanted to make is already, the points have already been made. Complying with parents' requests. Also, certain high needs children do way better swaddled and far beyond 3 months old. And when swaddling is done appropriately with a thin cotton receiving blanket, it's not unsafe. So perhaps there should be some training around that. But the other points that I wanted to make have already been made. Complying with parents, culturally sensitive, and I just wanted to also emphasize certain high needs children do respond better to that pressure.
Agree.
So that's it.
Thank you. We do have one question from Michelle Lewis Barnes in the chat box. She's asking, will the rules clarify if a provider can swaddle their own child?
So I think this is that place for public comment, Bobby. I don't know if we're still in the public comment period, but that, we will take that public comment.
You're on mute, Bobby.
Can you then, Bobby?
No, she's unmuted.
Did you mute yourself, Bobby?
Yes, I'm so sorry. Thanks for catching it. Yes, now can you hear me?
Yes.
Okay. I just want to be sure we get this in public comment clearly, that it's a clarification in the rules that if a provider has her own infant, it does or does not, the swaddling rule does or does not apply. It's a request for clarification. Is that correct?
Yeah, Bobby, I think that's what I heard.
Okay, perfect. All right. So thank you, all of you. And we will now open a conversation that is just for the members of the Child Care and Education Committee. And we can have an open discussion, but where we're headed is we will determine if we're in consensus with support of the rule, and that means that nobody gives it below a 3 on a 5-finger vote. So 5 means I'm totally in agreement, and 1 means you're not in agreement at all. And so if somebody, so what we will do is have our conversation, and then I'm going to ask committee members after the conversation if anybody would give it below a 3. And if we are in consensus, that information will go forward to the council. If we are not in consensus, then it will go forward to the council that this is a topic that they are going to need to deliberate. So I'd like to open now to any committee members. Sue, I think you had something you wanted to share.
No, I didn't raise my hand, so I think it was a different Sue.
Oh, I see. Okay. Thank you.
So is the draft language the one that we had on the screen a few minutes ago?
Yes, it is.
Okay. Well, then I disagree. I think this has come up I think we talked about this about a year ago, year and a half ago, early 2017, I want to say, where we talked about swaddling, and I talked about how me just having a child, the first thing that they taught you at the hospital is to swaddle. And I think some of the things that are being raised in the public comment are things that I echoed earlier about being culturally sensitive around that, because not everybody has their own way of taking care of their child. I think if we could do it in a way that's safe, I think we should move to allow swaddling, or at least find a compromise with a sleep sack or what have you. I think we already talked about it, but the swaddling was the thing that really got me when we first had this conversation, I want to say early 2017. And so those are where I stand right now. Anybody else?
Before, I just would like to be clear, Elvis. A sleep sack is approved under this language.
Right,
So,
that's why I modified what I just said. So the swaddling is more my concern.
okay.
Sorry, and as it stands, if that's the language that stands, I think I would give it a, what is our, sorry, I was just looking at our voting thing.
Yeah.
I apologize.
5 is total agreement.
Right, so I would give it a 2.
Thank you.
Bobby, this is Sabrina. I disagree with the sleep sacks either, but I am somewhat in agreement with Elvis in that I think with the swaddling, it becomes an area of potential concern that without proper training, or at least without something saying that there's been appropriate measures in place to ensure that appropriate swaddling is being done, I don't think that I could feel comfortable either agreeing to that one caveat.
You know what, Sabrina, I'm not quite sure where you land. So you agree, sleep sacks are not an issue because they're allowed under the rule. Do you agree that in care, the provider should not be swaddling? Or
I believe that with proper training, swaddling can be appropriate, but my concern is that we're not going to be regulating the training aspect of swaddling. And I think that's where we may see some potential dangers. I'm not in disagreement that swaddling isn't culturally appropriate in some cultures. I don't disagree that it isn't a useful tool that care providers are implementing currently. But I think even from the care providers we heard from today, they're knowledgeable in that category. They've received training. They feel confident in the steps that they're taking to ensure safety with swaddling. I don't think we're addressing that at all in these rules. And so that would be my concern, is that swaddling could be acceptable as long as there was appropriate certification behind it. And I think that's where we start seeing some concerns. So that's why I do not sit well with the swaddling. It's not that I disagree with swaddling entirely. I just disagree with the fact that there isn't any regulation around certifying that individual has been appropriately trained to swaddle effectively and with the utmost safety in mind.
Thank you.
And a quick question, Dawn. There are training groups that do swaddling or training for swaddling. Am I off on that?
Not
No. I think Elvis, it would be something we would need to look into to see, because I think that's a question.
So, hi, this is Leslie. So to Elvis's point about training, there's no training that exists on proper swaddling and out-of-home care. To my knowledge, I work at the Child Care Resource and Referral. And I've worked in, I own 2 certified family programs and a center-based care, and I've directed other programs. And swaddling is an issue because of lack of training and its abuse, for one. For 2, there are lots of sleep sacks available that don't restrict movement. I think the problem I have with our draft language is that the restricting is not defined. Someone could look at a sleep sack, a loose fitting one, and say that restricts movement because you don't have full use of your legs. So maybe just a little bit more definition, because I can see where maybe a certifier would go in and think someone restricted and maybe another one would not. So we need to get some more definition with that. And I just think that I do agree with not swaddling in group care. And I know that it takes time for new ways of taking care of babies to kind of stick over time. I know in our programs, when we tell parents that, the feedback I've received that they are being told that that is now the standard, and most of them are aware of sleep stacks and are not swaddling. So I don't think it's far-fetched that parents would have to get used to that, and it's difficult for some babies to adjust to that, but they do adjust. So I think we need to just get some examples of appropriate sleep stacks that are approved by the Child Care Division, and some more information about what we mean by restriction, so that people are not overusing that term or misusing that term rather. So I like where we're going with this. I just think we need to kind of flesh out the definition and give some examples of accepted kinds of sleep stacks we're going to use.
Thank you. Very helpful. Donna, do you want to weigh in on this?
Yeah, I was just waiting for my turn. I think I recognize the comments that were made, and it's a difficult issue because you want to respect the cultural preferences of parents, but if the child care provider that you take your child to hasn't been trained on swaddling techniques, then it could become a risk for the child and the provider. So I think that allowing the loose fitting sacks is a good compromise for not swaddling, but at least having an option.
Thank you. Abby?
Hi, thank you, Bobby. And thank you to my fellow committee members for all of your comments. And I think that my sentiments really closely align with Sabrina's very well-crafted statement. I have some pretty significant concerns about swaddling and in these particular settings, but also, of course, want to preserve the parent's choice and rights, but how we do that safely is still a looming question for me.
Sure. Thank you. Sue? Sue, if you're talking, you're muted. Okay. All right, so I'm sure staff is getting all of these comments down. Thank you. It is these were very insightful. So what I heard was we're not in consensus. It is going to go forward, but the concern of safety for infants and providers was shared across the comments, and there was there were some suggestions on how the language might be tweaked to be more clear about what we mean by restrictions, and staff will explore whether such a thing as certification exists. And
I just looked some up, Bobby. I just looked some information up, and it looks like Legacy and I believe also Providence have some nationally recognized trainers around this stuff. But I think it's not that it's not out there; it is, and I think this is just my contention as we're talking about this. It's something that is taught at the hospital to new parents, and then they take it home, get the child used to it, and then if you're going into it's like you're going back and forth. And I just want to make sure as we record these, we look for those trainings that are nationally certified, nationally recognized, and that it does exist out there. So as we move forward, that's my last part.
Okay. What I would like to ask staff is not training for parents, which I don't consider relevant for
it's for parents only.
I think it's for parents. Oh, is it for parents only?
Yeah,
okay.
I think the question is there some nationally certified or certification process for child care providers on swaddling?
Yes, please. Thank you.
Yeah, I'm going to guess not, because the American Academy of Pediatrics does not prove it.
No.
So, but the direction to staff is to find out if such a thing exists, because what I'm hearing that'll go forward to CAM is that the committee members share the providers' concerns about cultural relevance and meeting the needs and staying in good relationships with families, and the question is whether it can be done with safety. This is a huge issue for safety for, I think one of you said, I think Donna maybe said, it's an issue of safety for the provider also, as well as for the infant and the family. So I think, does that represent what the committee wants to send forth?
Yes, I believe it does.
Can I pose a question as well? This is Leslie again. I do think I know the answer to this, but I've heard this from providers in the field about the idea of a parent signing some kind of waiver to swaddle. I just want to have Dawn speak to that. I kind of know where that went, but just if someone could speak to that possibility.
This is Dr. Velasco. Can I speak a little bit about this, please?
Sorry, right now we're only, this is only committee members.
Oh, I'm sorry.
Yeah, well, no, I don't, but I would ask that you put your comment in the chat section so we get it. We want to hear all the comments, but right now this is a conversation of the committee members on what we're going to send forward to the Early Learning Council.
Okay.
It's confusing, I know, but please go ahead and put it in the chat.
Okay.
Thank you. Okay, Leslie has a question to Dawn.
Yeah, hi, Leslie. You know, I mean, I think that is something that, you know, based on the public input that we're looking at, in terms of where would that sit, I think that's part of this process, is to figure out, would that be acceptable when we think about safe sleep? And I think some of that is what will get posed at the council as well, in terms of decision making, in terms of what the language may look like.
Thank you.
Okay.
Good call, Leslie.
Thank you. Okay, so I think I'm going to close this section of the meeting. And Dawn, do you want to take us on to the training? I'd like to provide a little bit of context for this. This is one that the committee spent a great deal of time discussing and coming to recommendations we made to the staff. And our recommendations were all for substantially higher numbers of hours that end up in the rules. So the committee wanted to get much closer to the standards in caring for our children, and that's what we sent staff away to develop rules on. They were in this constant process of receiving public comment, and they, I am so sorry, I've got two phones and the other ones are ringing. Anyway, and they heard from provider all the constraints And so what we're going to look at now and discuss are the much less than this committee directed the staff to put into rule. So Dawn, will you walk us through the draft rule language, what we've heard from the public, and then we're going to open for public comment.
Yeah, certainly, Bobby. And I think one of the points that I want to kind of make up front is that part of the public comment that we've also received is about kind of the cost of some of these rules to providers, specifically around training. And so we are doing a fiscal impact statement and looking through all of the rules to see what is that fiscal impact around these new rules for providers. So I actually would like to ask Catherine to kind of walk through the draft rule language and kind of the public comment summary. Would you mind doing that, Catherine?
No, not at all. Can you hear me?
Yep. Yes.
Okay. So as Bobby alluded to, we'd met with the CCEC several times in kind of back and forth in working on training requirements. And what I would share with the group is that Caring for Our Children actually recommends that providers have 30 hours a year in training hours. And we've done surveys that sent out to centers, certified families, and registered families, kind of with maybe a graduated proposal of trying to move this up. And, comments have come back in, cost, availability, availability in languages, rural areas, et cetera, et cetera. So where we landed with draft rule language is making a step towards starting to improve training hours. So where we started with certified centers is they currently are required to do 15 hours of training a year, and we are, where we landed was that it moves up to 18 hours of training a year. And that substitutes, it's not really on here, but substitutes would also, that worked more than 60 hours in a year, would be required to have that training. And we did not currently have a rule about at what point do substitutes need to be taking the training as well. Do you want to go to the next one, or do you want to talk about each one individually?
No, I think it's just kind of an overview and what we've heard in the public comment. I think one piece about the substitute too is that was made to align because there was a requirement in certified family. So yes, I think just an overview, Catherine, and then we'll open it. Then I think Bobby will open it for public comment.
Great. So then in certified family, they're currently required to take 15 hours of training a year, and that bumped up 1 extra hour. And then in registered family, and same thing, that substitutes would have to take training if they worked more than 60 hours in a year. And that is different because the current rule, we did have a rule in certified family that if you substituted as a provider for more than 20 hours in a year, that you had to take training. And we had received feedback that that threshold was too low. So we made it 60 hours, and the same then for CF and CC. And then in registered family, the recommendation was that they go, so their license is for a 2-year time period. So the recommendation is that they go to a minimum of 15 hours of training. They currently have 10. That's in a 2-year time period. So, you divide that in half, 15 hours is 7.5 hours per year is what it works out to. So that's kind of a high level overview.
And I think the only piece I would add, Catherine, thank you, this is Dawn, is that, I think when you summarize the training requirements the feedback that we've received is it's primarily around the cost and the availability of training in rural areas. You know, I think there was a recognition in the committee about thinking about how do we remove the barriers, as we know that training and having, you know, is important for quality. Yep.
I would add that we did report back to the council earlier that based on the feedback from the rules, that it was raising an issue that the council had infrastructure challenges that it needed to address on its own, that training in multiple languages and throughout the state. And the other thing we heard was the range, so that that a provider anywhere in the state could get higher level training rather than just introductory training. And that we sent that to the council as it's not directly related to the rules, but the fact that it's constraining what we can ask of providers and keeping us so far below the national standards that we wanted the council to take it as their issue. So that's just more context. It's not really a rule. It constrains the rules, but it's not in the rules, and it's not going to be affected by the rules. So I think now we would like to open. So we're going to do the same process. We're going to open to hearing from the public and ask that you share your thoughts with us, and either in writing through the chat box or asking to be unmuted so that Chris can, so that you can speak to the whole group. And then when that is, and so we'll see how long that takes, and then we will move into a committee discussion of what goes forward to the council. So. Chris, has anybody asked yet to share a comment?
Yes. Yes, Bobby, we have a comment from Al Scott. I did unmute you, Al, if you would like to provide a comment.
Thank you. I have a question. For a licensed daycare center, licensed for 85 children, what if we have somebody that substitute 40 hours for us during a year? They could also substitute 40 hours at another center and 40 hours at another center. Is it just 40 hours working for, or 60 hours working for you? Or how do we know what the total number of hours someone substitutes if they need training? And then would we be in non-compliance if they went over the 60 hours, but yet they had not worked 60 hours for us?
That's very helpful. Thank you. Needs to be clarified. Okay.
One other question, if you've got a moment. In training, it's my understanding, and this is, I talked to several of the daycare centers, that training is an expensive cost because most of the wage earners are not making a lot of money. So you try to help provide other things, such as paying, you know, as far as for their classes. And when it's increased, it's always extra cost. But like now, the first aid set is training, considered training. And with the aid one, when you have high school students coming in to work for summertime, if you have to pay for their first aid, CPR, etc., and then they're just working for the summer, when you already have, they have to be with a teacher, one that's not left alone. And so therefore, there's already somebody first aid, CPR certified in the classroom. And it seems like it's throwing an extra burden on the centers as far as paying for this training, which when they're, you know, they may be there 3 months, they may be there a year possibly. And it seems like there's a lot of financial impacts that on a lot of these rules that have never been, I should say, it wasn't mentioned as far as in your initial spot on financial impacts on many of the rules. And I think part of it could be when I heard everybody in this committee, it seemed like most everybody was with a different organization, ESD, whatever, but it's not in private industry that has a bottom line that we have to make. And you don't realize how tight it is in the industry, to stay in business and to keep a profit. It's like I talked to a center that they have to pay a TriMet tax, like $42,000 every 5 years in the city of Milwaukee. And that's, everything that you keep adding on is extra cost, which causes the bottom line of childcare to be more expensive. And we're trying to keep costs down as we can, but yet there's so many more things, like when the TriMet tax thing was pushed in Milwaukee, it's out of your control, it's out of our control, but yet that's $42,000 that's got to come from the parents. But this is just one little thing, the education, the continuing ed, say, the safety set, which is considered. And that one seems to be an overkill to me when they're already a teacher certified in the classroom, and to be paying for a 16-year-old aide for first aid, it seems to be we could be spending the money better elsewhere. Now, if the state would like to offer free CPR first aid, we would love it. But, and continuing education, if they want to increase it to 30 hours, if they can provide free training for us to meet all the categories, because we found it very difficult to continuing education categories like diversity, to try to get people up to step 7. It's very difficult to find either free or very low cost continuing education. You may think $10 an hour is low cost, but yet when you're multiplying it times how many employees and how many every staff member, and then you keep increasing it 20% here, if your A2 is increased 100%, my understanding A2 wasn't in the previous rules, and now it's 12 hours. So there's lots of extra costs that's coming in. It's not that it's not a good thing. The more education is better. It's like a lower ratio is always better. A 1-to-1 ratio is the best ratio. But to try to have...
Okay. Thank you. So Chris, is somebody waiting now?
Yes, Bobby. Cromer is being unmuted. Go ahead.
Hi, I'm Ruth Cromer, and my husband and I are from Bend, Oregon, and we've been in the field for 18 years, and I participated on the committee with Bobby and Heidi a couple years back. And so my feedback is just the financial impact for the training is definitely a reality. So the thing I was going to say was that the math, if you have 30 hours that we're gunning for eventually to have the training hours at, and if we just take the simple, what it is now, roughly $10 an hour per class hour, that's $300 per employee that you have. Well, as a small home child care, we have 2 full-time and 2 part-time employees. That's $1,200 a year, not including my husband and I, that we have to pay for training. Now, if we add in the fingerprinting and the new background check, you're looking at $50 then per employee as well. And we're looking at possibly a swaddling class that we're going to have to take. And then we're looking at our food handler's card. So the cost per employee is very, very high. And parents are already complaining how expensive childcare is. It's a real concern for us to try to figure out how these costs can be kept down. If Child Care Division is going to have these, we are always happy to take continuing ed. It is the cost that is becoming a very large barrier as we look at increasing the, quote, quality of childcare in our field. The other thing I want to say is thank you very much for upping the hours for substitutes that come in. 60 hours is still quite low. That's like 1 week and a day a year for someone to come in and substitute, but it is much more reasonable than the 20 hours. My request was 100 hours in a year for a substitute, which could be prorated over the month, but that would allow someone to come in and substitute roughly 1 day a month without having to pay an exorbitant amount of training or make them come to all the trainings that you do for your staff. So thank you again.
Thank you. Chris, is there somebody in the queue?
I don't have anybody raising their hand. I do have some comments, which I've noted. And that's where.
I think we'd said, Bobby, we were strategizing that we'd let everyone jump in on the phone, and then once that has ended, Chris will kind of read through, for the record, the chat box comments that have come in, but we wanted to give some space for anybody else who wanted to provide comment themselves. But
Heavy.
do you have someone that Chris is unmuting now, it looks like? Okay.
Go ahead, Sabi.
Okay.
Oh, excuse me. Chris, somehow Al was cut off. So when we've taken this next comment, let's go back to Al.
Okay.
There was, we never meant to cut you off, Al.
Hello.
So whoever is trying to speak, please go ahead.
Okay, this is Sari Velasco, and I want to talk about this a little bit. It's very important, and we want to have a quality. If the early learning division wants the providers to have a really high quality programs, they need to help more with trainings, and especially with other languages, because there's not too many trainers that speak Spanish or other languages, and that's really important because sometimes when you need to find trainings for special needs, you cannot find anything. So that's very important. I have a certified program, and me and my staff, we always require to have 25 hours of training each year. But it costs money, like other people said. So just keep in mind that it's really hard to find in other languages, so that's really important to have other trainers, they speak different languages. Thank you.
Thank you. Al, did you want to, you said you got cut off?
Yeah, my internet. Yes, my internet connection died at Wi-Fi, and I just reconnected. And I just didn't know when it cut off because I was talking.
Oh.
I don't know what last comment I made that you heard, or if I was just rambling without, anybody hearing. So I apologize for the poor internet connection I had. But I was talking as far as in regards with the continuing education, and also with the aid ones having to have the first aid CPR when there's already a teacher in the classroom, which adds extra continuing education expenses to the licensed daycare centers, which I feel the money could be spent better elsewhere.
Okay. Thank you.
Thank you.
Hi, this is Chris. Angie had a question, and that is, how is the more training going to affect star-rated programs? We also would like to say that Set 2 and Set 3 trainings are hard to find. College classes are very costly. And then Anna Pickle, I'm unmuting you now. Go ahead.
Hi, I just wanted to reiterate what I saw Michelle write in the comment box, that just because you're necessarily increasing the number of hours that's required does not mean that people are taking quality trainings that are actually going to, make them better at their jobs. So you can there are lots of Set 1 free classes or very low cost classes that you can take online. But I can't say that many providers would really be getting anything from those classes. So in some ways, upping the training hours, you could potentially just be creating busy work for people, just kind of like checking a box. Oh, I did this, these 2 one-hour classes. I'm good. I don't have to worry about this anymore, but they're not necessarily going to be learning anything from it. I think it would be more beneficial to quality of care for there to be more maybe specifics. Maybe you don't have to take as many training hours if you're taking set 2 or set 3 trainings, because if you have participated in the different levels of training, a set 3 training is significantly more comprehensive than a set 1 or a set 2 training. You know, usually you actually have homework, and you are actually having to prove to the trainer that you are comprehending the material and taking something away from it, which is not happening if you're taking a free set 1 class online. So I understand everyone else's comments about the cost of it. I pay for my employees to do their trainings as well. I'm spending over $1,000 on training this year because I want my staff to be taking high quality training. So we're not just taking whatever's free and easy that we can find on the internet. We're attending conferences and doing other things. But we're also fortunate to live in the Portland metro area where there is a lot of that readily available to us, where in other parts of the state that is not necessarily the case.
Thank you.
Hi, Bobby, this is Chris. Rihanna wanted to speak. Are you on the phone,
Hi.
Rihanna?
I am. This is Rihanna Ruley, and I'm a certified family child care provider in Myrtle Creek. And I wanted to say that I really support this rule revision. I think that it was a reasonable compromise from the original hours that you were looking at, that the committee's goal was. And even though I know that there are impacts, there's financial impacts, accessibility of training has to be considered, I think that this is something that's important and that all child care providers should be getting more training. So I appreciate that. Thank you.
Thank you. Chris, is anybody else in the queue?
I don't have anybody else at this time. Oh, Annalise has a comment. Let me unmute you, Annalise. Go ahead.
All right. Hey, I just want to put out there that I have heard from several resource and referral agencies, and I don't think anybody, or maybe somebody is online from them, today, but I don't see anyone. I've talked to resource and referral agencies, and I know our union trainings. There are a lot of really good trainings out there that are being canceled because people aren't registering for them. So I think that there are trainings out there. I just don't know if it's the wrong night, they're at the wrong time, they're the wrong Saturday. I'm not sure what it is, but I know that there are several resource and referral agencies who have stated to me that people aren't coming to their trainings, even when they're $5 or $10 a participant for an all-day training. And there are lots of opportunities out there, but I think that they're not being marketed. For example, AFSCME and several of the other trainers out there that provide free trainings, we aren't on Oro. We can't post our trainings on Oro. So if people are out there looking for trainings, they can't find our trainings in English and Spanish unless they know exactly where to go to get our calendar for our website. So I think that there are some easy fixes that might cost a little bit of for technology support, but I think there are fixes that can be done to address the costs, the issues around finding these trainings and availability. But I don't think that addressing them in a rule is the place to address those issues. So the rule is good. I think providers need more trainings. I think that the state and its partner agencies need to do a better job of marketing, getting the word out, and providing funding.
Thank you. Chris, is there anybody else in the queue?
I do have a couple more comments in the chat box, but we can save those until the end.
I would like to piggyback on what Annalise is saying. As a provider of many years, I have a tendency not to go to every single training because time is more than money to me. Yes, we spend thousands of dollars maybe each year on these trainings, but time, I get so little time with my family. That's what I'd like to say about it.
Are you a home-based provider?
Yes, I am. I'm a registered home provider. And so I will, it sounds like I'll be upping up to 15 hours, which is okay. Again, I just put it in and I get it done, and I do what I can do when I can do it. But here I work until 5:30, and then I got to turn around and cook dinner and get the family going for bedtime. And it's just nonstop. And so if I see a training that's available and it's available at 7 p.m. on a Tuesday night, I'm not going to go to that. I've got kids choir. I've got lacrosse practice. I've got dinner to cook. It's just chaos. So I understand upping it. I understand that that's the way to go. It's just time has become money. Is more important than money.
More important than money. Okay.
Yes.
Other? So Chris, do you want to share? Oh.
Go ahead.
Somebody wants. I was just going to ask if you wanted to read the comments that have come in on the chat box.
Yes. Yes. So Sue Mackey says, I don't need to talk, but would like to my voice heard. I'm a registered provider, and I am all for more training hours being required. I've actually told you just about everyone who will listen that I believe there should be more training required in the area of child abuse and neglect. You have one incident where that training becomes useful, and I guarantee you'll wish you had more training. But besides that, I have real concerns about rural areas getting quality training and in languages other than English. Gayla says, enable early childhood education teachers to take upper beginning classes, put training dollars where it works for everyone. And then Anne Marie Holloway, I'm sorry, I can't see the end of the hyphenated, says, I agree with more training. I like there is never too much training. However, it makes it difficult for the smaller sites to allow for training. It is hard to balance required staff members to take the training as we cannot afford to pay them to take the training. Angie says, how is the more training? Oh, I think I had already said that one. Sorry. Hang on. Michelle Barnes says, I've had the same experience at, sorry. Sue Mackey says, I don't.
I think she's saying she's had the same experience as Annalise has.
Yeah. And it looks like that's the end of the comments.
Did those come directly to you, or are they on the group text that everybody can see?
They're on the group.
Thank you.
Bobby, we're just looking at time, so we've got about 20 minutes left if you wanted to close public comment so that the committee can kind of wrap up.
Yeah, I'm just watching. I'm watching the time. Thank you.
Great.
Okay, some more comments have come in. My question, Chris, is I assume that the software is collecting all of these so people can keep adding comments and they'll get put into the process. Is that accurate?
Yes, Bobby, you're correct. It will send me a document with the whole chat log to my desktop.
Okay, so so that the committee members have enough time to see if we're in consensus on the proposed rules about training. We're going to close public, but please know that you can continue to add to the chat box now, plus the Office of Child Care is continuing to take public comment, and the hearing will be next Tuesday. So this isn't ending your chance to share your opinion. It's just we're going to move to the next stage now. So at this time now, committee members, it's a little hard because it's on 3 different screens, so you can't see it exactly. So committee members, if you want Chris to move the page to center or certified, please just ask. But at first, we're just going to have an open conversation. Although, you know what happened last time, maybe isn't a helpful way to do it, is actually people shared where they were on the 5-finger voting kind of thing, on the proposed rule as they shared their thoughts. So maybe you could share comments and go ahead and also share if you can give the proposed rule language a 3 or above.
So this is Leslie. I'll go first. So I'm willing to give it 3 is in full favor, right, Bobby?
5 is you think it's the best thing that ever happened. 3 is I can support it. 2 or 1 means no, I can't support it.
Okay. So I could give full support for it. There were things that I think we had wanted to ask for, but we thought we maybe couldn't ask this time. One was in light of where we're at with Spark. We found a lot of providers in the field that were having a hard time reaching step levels because there had been such a low amount of training that was required in the past. So I think we were thinking about that when we came on, landed on 18 hours. But I do think there is something to say about some of the comments, which I thought were great ideas about if you were a certain step level, maybe you didn't have to take as many, or maybe it could be if you took set 2, you wouldn't have to take as many hours because that's a higher quality or higher level of training. And I think that is actually very helpful. But in light of the comments that were said about there not being enough set 2 or 3 available, I don't know if that really helps. But I also did want to concur with a woman earlier that said that there are a lot of set 2 and 3 trainings available because I work at the R&R, and we do have to sometimes, really shut classes down, or our training coordinator is not only sending out the newsletter, but sending individual emails out and still can't fill those classes. So there is some kind of mechanism missing as far as us sharing those trainings to people so they can actually attend. And there's also an opportunity for us to do more hybrid training or distance learning training. We've had rural area providers join in on some of our trainings in Multnomah County, so they could participate in set 2 or 3. So I think the system really does have to look at ways to really allow providers to participate. But with that being said, I am in favor of us adding more training. I think that it does matter though what the quality of the training is, and I don't know that we're there with that yet, but at least starting with more is better, and it will get more people able to participate in Spark as well. So that's my piece.
Okay.
Bobby, this is Donna, and I do know that training is really important if you want to improve the quality, but I also recognize that when you've worked all day in a child care setting, it's really difficult to get those in. And I don't know if this is even, if it adds another layer or it isn't even something that could be done, but having a waiver process so that you can, if you run into difficulties, that you have the ability to maybe not have as many hours, but you have to have a plan with it on how you're going to meet the requirement over a period of time. And then I think also as a division, we should look at how we can provide training for childcare providers. Also recognizing that we have the same issue here. We have a lot of training, even though we're out in the middle of nowhere, and childcare providers just do not attend. So that's a separate issue. So you have to have some hook to up their quality and qualifications, but still be sensitive to the fact that it's difficult. I would probably give it a 4.
Okay, thank you. Sue? I wonder if she's on mute. Sabrina, do you want to weigh in?
Yes, Bobby, I too would give it a 4 and would concur with the previous comments that were made as well. But as it stands currently, I'm in favor.
Thank you. Okay. Abby?
Hi. Yes, I would also give it at least a 4 to 5, and do understand the challenges of additional training hours, but feel really strongly that our children need highly qualified teachers.
Thank you. Elvis?
I would give it a 3. I have some concerns around some of the public comments. I mean, it's real money that it takes, and that and the amount of availability, and then the issues around communicating trainings that are already happening. This just makes me like work even harder for some revenue this upcoming session, just because like some of these things could use some money. And it's just hard. That's where I'm at. I just have some things that I think hopefully we can address, some things that hopefully don't cost money that we can help along, and try to connect those things. But I think I'm a 3 right now.
Okay, thank you. Sue put in the chat box that she would give it a 5. So that is, so here's what I heard, so you can test me. We all gave it a 3 or higher. So we're reporting to the council to first that we are in consensus for adoption of the proposed rules. And I think almost everybody expressed concerns about, and I took, I don't know, the availability, diversity of languages, rural, the quality of the courses, the financial considerations, and then a complex set of issues that have to do with whether the problem with higher level training is availability or not being marketing, I think was one word that was used, but there a number of people have described the closing courses at the same time that we're saying there's not enough. And it's, so there were, I heard those as direction to the staff to explore outside of the rulemaking process and to consider in future thinking about rules, not this set of rules, but revisions as we move forward. Maybe some kind of system where, as training was more complex, it counted for more hours. Anyway, it was so now let me stop and ask committee members, did I hear what people said?
It's good for me.
Yes.
Yes, thank you.
Yes, Bobby,
Okay.
thank you.
Okay. Okay, and so I think that I don't know, we've done the work for today, and what's up on your screen is kind of next steps. And if people are not aware of exactly where to send written testimony, the address is listed, and the address and time of the public hearing is there, and then this will all be brought together in the rule adoption process on May 31st. So those are the next steps on the rule process. And for the committee, we're going to go back into our focus on being part of the strategic planning and moving forward some of the items that the committee has identified as needing more attention by the council. And so June, we'll go back to that agenda. So I'd like to leave a few minutes for any closing comments by committee members. Okay. Well, I would like to thank the committee. It's almost 2 years of work that we've put into this childcare rule revision process. I have heard in a couple of places that there are providers, despite all our efforts to engage people over 2 years, we still have a lot of providers who weren't aware of the rule revision process. And that, of course, does not feel good, especially since we tried so hard in so many different ways to engage providers, as well as parents and others in the process. So I'd like to recognize the job this has been for the staff. This has been a huge amount of work to align the rules across the types of care and to go through this process of balancing the standards that tell us that we're going to do a good job of serving children and families with the real life constraints that the early learning providers face, and in operating programs and meeting the rule requirements. So that has been a huge amount of work. And so I just want to acknowledge and thank the staff. You're not done, because you're going to have to keep at it. And Dawn, you said something today that I think is worth sharing. When we get a set of rules, it's not like the door closed and we're done. It's as soon as one set of rules is adopted, we're constantly listening to see, did we miss something? Do we need to tweak something? And there's a rule revision process that So I think that's also helpful. I think that's what you meant, Dawn, when you said this is an iterative process.
Yeah, exactly. Yeah. Thank you.
Okay. So also, so that it doesn't feel like it's over. It's never over. This is a big step, but it's not that we're ever going to be done with trying to find the right balance. So, okay, then I think we are adjourned until June. Thank you, everybody. And thank you all the members who shared your thoughts. Thank you.
Thanks, Bobby, and committee members and public testimony.
Thank you.